This is an emergency that many people will miss, even doctors. And if you miss it, the patient will die in as little as 24 hours. Let's go through the case together. Can you make the diagnosis? I'm going to share it right in the end. I'm an NHS-based doctor and surgeon. Please follow and share for more health discussions. Now, a patient who's 40 years of age has just come back from abroad. They've just had cosmetic surgery. In fact, you ask them and they say that they've just had liposuction. Well, they come in with temperatures, but listen to this. They also say that they've been feeling really tired and that they've been throwing up. Now, you go and look at their blood tests and you realize that they've got very high infection markers. In fact, their white blood cells that fight infection are about 25. They should be no more than 10.5. Now, you then go and examine the patient and realize, as the surgeon who's just been referred by the emergency department, that on examination there is lots of redness throughout the tummy where they've had the liposuction and also around the thighs. You start to think about a potential diagnosis that is very life-threatening. Now, what do you do next? Well, you need to make sure that they've got a cannula because this patient has a high temperature, a high heart rate, and you're worried that they have sepsis, which is blood poisoning. The cannula is so that you can administer fluids through it, but also so that you can adequately resuscitate them with fluids as well as giving them antibiotics. You send all the relevant blood tests, including blood cultures, and you ask to make sure they have a urinary catheter, as you need to make sure that they're stabilized. Now, what investigation do you need to do next, and what are you thinking about? Well, one of the things you can do is you can do an X-ray, and the reason for this is when you feel where the skin is red, you notice that it feels a bit like bubble wrap. Now, that's worrying because that's known as crepitus, which means that there may be gas forming inside just under the skin. Now, that gives you an even better clue. You do the X-ray, it shows some gas, or better still, you can even do a CT scan, and the CT scan shows infection throughout, but also lots of gas. Have you thought about what the diagnosis may be and what should you do next? Now, this is an emergency. This is necrotizing fasciitis, which is a life-threatening infection which is caused by different types of bacteria, including Streptococcus strains, which can then spread like wildfire. And this patient needs to go for an emergency operation because otherwise, if you don't control and remove all of that dead tissue, this will effectively carry on eating them alive and they will end up developing life-threatening complications or even die.